विश्व में हमने युवाओं की आईटी एनर्जी के माध्यम से अपना एक रुतबा खड़ा किया है और भारत इसके बाद के लिए गर्व कर सकता है। दुनिया में हम आंख में आंख मिला करके बात कर सकते हैं। और ये मेरा साफ, मैं हमेशा कहता आया हूं, आईटी प्लस आईटी इज इक्वल टू आईटी। इंफॉर्मेशन टेक्नोलॉजी प्लस इंडियन टैलेंट इज इक्वल टू इंडिया फुटबॉल।
Good morning, everybody. I welcome all of you in the second edition of Elets Digital Health Conclave, organized by Elets Technomedia and eHealth Magazine, with the support of our partner Neosoft Technologies, WebWorks Data Centers as our exhibitor. This second edition is the continuation of the first edition, which was successfully organized last year. And this year also, we had a wonderful day one, participated by leaders from National Health Authority, NDHM, Ayushman Bharat, various hospital CIOs and CEOs, and various health experts discussed yesterday on important issues around digital health, not only in public health, but also in the private health sector. There were a lot of innovations being discussed. Today as well, we are having some key points to be discussed today in terms of how digital health ecosystem is taking place, especially in this era of COVID-19 pandemic, which has brought huge transformation in healthcare delivery, not only in India but across the world. And people have started, going more aggressively towards the digital way of healthcare delivery. And when we talk of digital way of healthcare delivery in India, Ayushman Bharat is comes in everybody's mind, and a very ambitious scheme by government of India, and with the mission of reaching to the people at the last mile. But again, there can be a lot of challenges. There can be a lot of opportunities, hidden opportunities, untapped opportunities. There must be some scope which yet to be achieved. So a lot of things to be discussed when we talk of digital health, and Ayushman Bharat has to be discussed in that forum. So here in the opening session of Digital Health Conclave second edition, we are taking this topic, one of the most important topic of Ayushman Bharat, the opportunities, the scope around it, and the challenges which are being faced or can be faced, and how to overcome them. And the audience has started joining us on our avatar virtual 3D platform, which is a multifaceted platform for our audience. They can ask questions, they can network with each other, they can see virtual expo. So audience has started joining, and huge number of audience in hospitals, government sector, IT sector will be watching this session and other sessions thereafter. I would like to introduce the eminent panelist of this panel discussion in the opening session of Digital Health Conclave, second edition. I would introduce Dr. Ajay Agarwal, Director of Health Policy and Quality Assurance, National Health Authority, Government of India. Warm welcome to you, Dr. Ajay Agarwal. I welcome Mr. Rajat Agarwal, Deputy Director of IT, Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, National Health Authority. Welcome, Mr. Rajat Agarwal.
Thank you.
Dr. O.P. Yadav, Dr. O.P. Yadav, Chief Executive Officer of National Heart Institute. Welcome, Dr. O.P. Yadav. Mr. Ravi Shankar M. Sankeshwar, Chief Information Officer, Administrator of TCLES, IT KLES, Dr. Prabhakar Kore, Hospital MRC. Mr. Ravi Shankar, warm welcome to you. And before we start the discussion, I would request each of the panelists to give your initial remarks, maybe in 2-3 minutes, on this topic, so that we can create a context of the discussion. I would request Dr. Ajay Agarwal to please give your initial remarks on Ayushman Bharat opportunities, scope, and challenges. Dr. Ajay Agarwal, please. You're on mute, sir. Please, if you unmute yourself.
Sorry.
Yes.
Good morning, everyone. Ayushman Bharat Yojana is the largest public health insurance scheme globally, covering around 500 million citizens. AVPMJ was launched in September 2018 by Honorable Prime Minister of India. It covers 24 specialties with around 1700 packages. It gives coverage of the 5 lakhs per family per year. Presently, we have empaneled 24,000 hospitals across the country till date. And almost nearly we have given treatment to 2 crores beneficiaries. Very soon you will see at present we have already covered 1 crore 99 lakhs beneficiaries, more than that. This is the basic of this scheme.
Right. Dr. Ajay Agarwal, I think you have mentioned some of the basic points of the scheme, so that our audience understands how large the scheme is, and how government is very ambitious to reach the people through this scheme. Mr. Rajat Agarwal, you are Deputy Director of IT, in Ayushman Bharat, one of the most high tech, I think, to make the scheme simpler for people. I think a very complex IT structure is being developed by the government. So just tell us about your initial remarks on Ayushman Bharat from the perspective of IT.
Thank you very much. See, Ayushman Bharat has a very strong digital backbone in order to, provide the last mile services to its citizen in form of uh, a common platform throughout India, where all the hospitals, the patients, and all the stakeholders, in fact, of the scheme, can participate, and they are able to engage and get the services in a seamless manner through this platform. So the I would say that the IT infrastructure in Ayushman Bharat, yes, you are right in saying that a very complex and a huge infrastructure uh, backing this scheme, in order to facilitate the services, end-to-end services for that matter, from the point of registration till the claim settlement at the last step, is all automated through the IT systems, which ensures that there are no issues, and the services that are provided are seamless and effective. So thank you.
Right, Mr. Rajat Agarwal. I think for seamless services to people, you have to deal with a lot of IT, and how IT must be the biggest enabler in doing that. We'll come back to you with more questions. Now I'll request Dr. O.P. Yadav. Sir, you are CEO of National Heart Institute, one of the premium institutes of the country. How do you see Ayushman Bharat and the challenges and opportunities? Sir, please unmute yourself.
Well, thanks a lot. Well, it certainly is a laudable initiative. There is no question about it. And the two polarized views, one side, certain sections saying it's a great failure, and the second, obviously, the government saying it's a great success. I think the real story is somewhere in between. The two extremes never actually, the absolutes are never applicable in anything in life. So it's an extremely important initiative. There is no doubt about it. There are certain issues regarding its implementation, its funding, issues regarding it's truly reaching the people that it is supposed to reach. Has it succeeded in that? So those issues one can debate, but certainly it is a step ahead of its previous avatar, which was the RSBY, and certain state initiatives like the Arogyashri in Karnataka and some other states similarly. So it's a step ahead of that, and I think I would say any initiative is a good initiative, and when started, you will have failures, you will have difficulties, and one would have to surmount them. But just because you will have difficulties, not starting an initiative would in fact be a horrible thing. So it's a wonderful initiative. It has not reached what it targeted to, and I'm sure going forwards we shall achieve what the government intends to through this scheme. Thank you.
Yes, that's right. I think, as you said, that it might be more of technology integration in the when the previous initiatives like RSBY, and we also know about Andhra Pradesh, that scheme which you mentioned, Arogyashri. And it is always right that even a bad plan is better than no plan. So, but definitely, this scheme has a lot of potential to prove itself in future. I would like to now request Mr. Ravi Shankar to please share your thoughts on Ayushman Bharat. Mr. Ravi Shankar.
Yeah, good morning, everyone.
Come on.
Can you hear me?
We can hear you. Yes, we can hear you.
Am I audible?
You are. You
Am I
can
audible?
be more audible. You can be louder, sir.
Yeah. Good morning,
The
everyone.
scope of being louder. Yeah.
Ayushman Bharat. Ayushman Bharat is such an innovative idea. Like poorest to poorest people can think to get a quaternary care services like right from kidney transplant to heart transplant, which was earlier a challenge. I mean, the service offered by the involvement of a private sector hospitals towards a Ayushman Bharat scheme is a really innovative idea. What I feel, as far as concerned, Dr. Yadav was mentioning about that empanelment. Already, Karnataka was having a scheme like Vajpayee Arogyashri. The same is upgraded version like Ayushman Bharat. So, we here to say that IT plays a very innovative role in this, as Rajat mentioned that right from initial registration of a patient, right from billing and till settlement, entire cycle should be a paperless. In this, IT will be the major role. What I feel.
Right.
Thank
Right.
you.
Thank you, Mr. Ravi Shankar. I'll come to you, Dr. Ajay. You are Director for Health Policy and Quality Assurance in National Health Authority. I would like to know from you that every state, like some state, has some different healthcare insurance scheme or things like that. How do you think? How can you unify all the states with Ayushman Bharat? Do you face any challenges from state to state, or how to make it more successful in every state of India? Dr. Ajay.
Yeah. In this program, we are including all the beneficiaries of the state-related schemes. They are included in our program, whichever states have joined Ayushman Bharat. Now, very soon, Telangana is also like to join, most probably by the next week, It will join only Odisha, West Bengal, and Delhi is left to join this program. And whatever schemes are going on in their states, we have included their package as state-specific packages, as well as included all the beneficiaries they are covering in their scheme, which are not covered in our SECC data.
Okay, so that is a very important thing that even if other states have their own schemes, their schemes are included, not avoided, are included at
Yes.
state-specific schemes.
Yes.
So that scope is there in Ayushman
Yes.
Bharat scheme. That's right.
And by now, I think about 22 crores beneficiaries of their scheme. Some beneficiaries are common in our scheme as well in the state-specific schemes. So, addition of around 22 crore people are included in this scheme.
That is huge. I think that is huge. And Mr. Rajat, if I ask you, you know, when all these integration happens, I think what is the role of technology, in minimizing the efforts, human resource requirements are there, fraud control have to be there. You have to build higher levels of trust among all players in the ecosystem when you do all these integrations. So what is the role of technology here, there, Mr. Rajat?
See, I would say that to bring so many different schemes with so many different constructs on a single platform is itself a very challenging part, which the technology part of Ayushman Bharat has very successfully been able to do. It has been able to provide that flexibility in terms of integration of various states across India. And there are some differentials in terms of the scheme constructs, the databases of the beneficiary, the process of enrollment, the way that the packages, etc. So basically, there are some variations across the state, and these variations are taken care by the IT platform in order to ensure that there continues to be some differences without distinctions. So they continue to be a part of our platform, and the services that are provided by Ayushman Bharat are delivered to the various states. As far as the second part is concerned, I would say that uh, the scheme itself has a separate capacity building unit, which ensures that all the stakeholders are adequately trained in the use of the platform. Access restrictions wherever possible are ensured. Security is given utmost priority in terms of data confidentiality. A very safe and secure storage of PII, having data vaults. So these sort of technology have been deployed at various stages in order to ensure the security and seamless benefits to all the beneficiary without any compromise in terms of their personal information, etc. So that is ensured. Thank you.
Right. So data privacy is also ensured. I think I'll have to come to you on that part. I asked the same question to the director IT yesterday, and Dr. Vipul Agarwal. Data privacy actually, Abhishek Kumar and Dr. Vipul Agarwal, is an important issue. So first I would like to request you, Dr. OP Yadav. You are you enjoying the leadership status in this healthcare sector from years now, and being a National Heart Institute CEO, what do you think? You know about the data privacy in such schemes, and how these schemes are they so much vulnerable of data theft? So, as a healthcare leader expert, what is your view on data privacy in such schemes like Ayushman Bharat?
Well, I think Rajat, spoke about the checks and balances that have been placed. But then, as I said earlier, there can be nothing absolute. So there can't be 100% checks and balances. And there is a scope of breach of confidentiality and privacy. See, for payments, for example, we have insurance companies involved and TPAs involved. Now, the TPAs, a lot of these TPAs are foreign-owned companies. So data goes in their hand also. the leak can take place at that end and not exactly at the central. So there is always a scope for breach, and on these matters, there can be no upper limit. Whatever level of security we can take it to, we should, obviously fully realizing that there is a financial difficulty, there is inadequate funding of this scheme, and the more we spend on these ancillaries, it will take away from what money we are allocating to clinical care, which as such is pretty low. So it's an important issue, but I don't think we can sort of plug it in total entirety.
That's right. That's right. Now I'll ask Mr. Ravi Shankar from a aspect of a hospital. You said that it's a very good scheme and it has a lot of potential. Very much right. So, as a you know leader at a hospital site, what do you think? What sort of expectations you have from this scheme? Are they all met, or do you see any challenges in from a perspective of a hospital, Mr. Ravi Shankar?
As said by Rajat, the confidentiality of a data. As far as concerned to Karnataka, we have already built up with a website called Suraksha Arogya Kavach. That all the government empanelment is coming under that website, and all the claims and taking care. So as far as the security control, uh, it's almost all measures have been taken, and as a implementation down the line, 3 years, majority of the issues got resolved, like right from the catering all the data of the patient, and providing the services and getting the settlements. The software is intact. I mean, we are not facing any major challenges in the using the software, I mean, provided by the government portal.
Right, right. Dr. Ajay Agarwal, what sort of challenges do you face as NHA dealing with a lot of healthcare entities, hospitals, GPAs, health insurance providers? What sort of challenges do you face and how do you overcome them? And can you throw some light on that, Dr.
As
Ajay?
Dr. Yadav, as Dr. Yadav told already, we are facing many challenges at present because this scheme is very basic stage now. Only 3 years are going to complete. First challenge we are facing that as issue related to quality of the decade-old SECC data, we are not able to still able to find out the 30% eligible beneficiaries of the family. Secondly, there is absence of hospitals in remote area of the countries, whether public or private. It is also a challenge to give the advantage to our beneficiaries. Third thing, what I feel is the lack of trained manpowers at the ground level in many states. And on one hand, we are not able to trace beneficiaries, while on the other hand, lack of awareness among the beneficiaries is also a challenge. They are not utilizing the scheme as they are not aware still. We are working on this. Card generation formation is going on continuous basis, and these are the few challenges in the scheme which we are trying to meet out.
Right, Dr. Ajay, you're very much right. The ground reality has to be checked. When you talk of these schemes, they should reach to the ground, and there must be challenges there. And you said that there is a challenge of awareness, there's a challenge of reaching out to the rural sectors, and the government is trying its best to overcome that. I would like to ask you, Rajat, when along with Ayushman Bharat, National Digital Health Mission goes, in parallel. And I was yesterday. I got a Paul Agarwal and other people when we interview from NDHM or from the other people from NHA. They say that like UPI, even government is trying to create a UHI, Unified Healthcare Interface, where people can share their data with each other. There can be various stakeholders involved. So there should be a medical records and digital lockers and all things like that. But when there's a problem at rural place where people are not even connected, people need to be aware. There is a problem of skilled labor, majorly in IT. They should be skilled how to deal with it. So all these challenges which are there, how technology can help, and how just give us some insights at how you are trying to use technology to meet out these challenges, majorly in rural areas, majorly in terms of skilling people with IT in remote areas. So tell us that how when government is so bullish about NDHM, how Ayushman Bharat can be taken to the last mile using IT.
Yeah. So, see, in any scheme like Ayushman Bharat, where we have to reach the last mile or the last person who may not be as tech savvy, as someone we generally see in terms of using our digital platforms, we do have to, ensure that there are sufficient provisions in our platform in order to facilitate that last beneficiary. So, one of the ways to do it is to ensure that the technology or the amount of IT interface which that person faces is bare minimum in terms of easy data inputs, automatic fetching from the databases, and bare minimum collection of the data at the beneficiary level. So that is one thing. The second part of this is in terms of training. So I would like to say here is that mediation or introducing a person who is going to facilitate a facilitator for that particular beneficiary in order to enroll him as a part of the Ayushman Bharat plays a very significant role. So we have what we call as Arogya Mitras, PMAMs, who facilitate the enrollment of the beneficiary at the ground level, and that plays a very crucial role in terms of ensuring that we have someone at the village level, we have someone at the grassroots level who is able to use our digital platform in order to enroll the beneficiaries, and create this massive databases which are there for these beneficiaries to prevent any duplication of the data, etc. So that is one part of it. The other part of it is obviously in terms of training, in terms of organizing the training with the various states at time to time level, and the third part is obviously in terms of addressing any issues which the state communicates to us at different points of time. So these issues do not merely are in terms of the functional changes, but there are definitely a lot of changes which we get from time to time in terms of ease of use of our platform, or whatever convenience factor which they see in terms of the previous platforms they were using, or in terms of what they desire the technology platform to be. We do take those suggestions into account, and we keep on modifying and improving our platform from time to time. So that is one of the key ways in which the digital platform is able to address the various issues that are there at the ground level.
Right, right. I think I would like to ask you, Dr. Opi Yadav, you are heading one of India's top leading providers of world-class cardiology and super specialty healthcare. You might have different strata of patients coming to the hospitals. As a hospital, how do you leverage this Ayushman Bharat scheme, and positives, and what sort of challenges do you face in leveraging such schemes like Ayushman Bharat?
Well, certainly, even tertiary care hospitals in the major metropolitan cities, we are obliged by morality to serve the section of the society which we were finding it difficult because of limitation of finances and so many other things. So Ayushman Bharat does empower us to deliver care to this section of the society to which we owe moral obligation. So we are not doing them a favor. We owe it to them. We take medical education. I paid 360 rupees a year for my MBBS. Rest of the money came from the taxpayer and even from the poor people. So that's an important thing. The challenges are huge. Dr. Ajay Gaul very clearly mentioned about the awareness, and that's extremely important. Second thing is the change of the behavior of these people, because right now they have more of livelihood seeking behavior. They want to earn the living first. And it's not they want to earn, but they're obliged to earn because otherwise they don't get food to eat. So health seeking behavior takes a back seat. Therefore, even if they are Ayushman Bharat beneficiaries, they present late to the hospital. Even when we do the treatment and discharge them and say there is a convalescence period, they don't, take that convalescence seriously. They go back to work. They don't take medication. So those issues are very important with them. And second, we find that coverage just to that bottom 40% is not adequate, because there is a group of low middle class which is near poor, really not able to afford tertiary care, and yet they fall out of that ambit. So this coverage has to go slightly beyond right now what we are targeting, 10 million families and 50 crore individuals. So it needs to go a little beyond that. And there are lots of other issues we can discuss as we go along.
Right, Dr. Ajay, I would like to request you to, reply on this or respond on this, that the kind of coverage, has to be, do you think it should be revised, or to have a larger gambit of people in this scheme? You're on mute, sir.
Agree. National Health Authority is continuously working on this. We are trying to include the ration card holders. Work is going on. In addition, as I told previously also, we have included all the beneficiaries of state-specific schemes. We are including other ministry data to merge in this scheme, so that more like Board of Construction Workers, we are going to include them also.
Right. So you think that viewers keep on working on this, expanding the
Yes.
coverage of the scheme?
Yes,
Okay.
basically the aim of the scheme is the basic first step of the universal health. Government
Hmm.
is going towards the universal health slowly, and this is, I feel, is the first step towards that.
Okay. But we have seen there are a lot of defaulters, hospitals, even legal actions being taken on them. They don't comply this Ayushman Bharat or other health insurance scheme. Well, how do you see this thing, this challenge of hospitals not comply with the scheme? And just share your thoughts on this part, because it is also a major thing. We see, not in this scheme either, maybe, or other scheme. We see a lot of news in newspaper that this hospital has not done this hospital has not done this. There's some, so all this is always in news. So how do you try to manage this, that all the hospitals comply with this Ayushman Bharat? Dr. Ajay.
We we have continuous 24 into 7 call center, and we are continuously getting calls of such cases. Despite of that, National Health Authorities has National Anti-Fraud Unit, and every state has their own state fraud detection units. And they are continuously working and taking action and giving notices to these hospitals. They have been impaneled many hospitals till date.
Right. Mr. Ravi Shankar, I would like to ask you why this problem comes in every health insurance scheme, that the impaneled hospitals don't comply with the scheme rules and regulations. There are, there have been scandals also on this, fake billing, fake patients, and all that. What is the reason behind it? Why it happens so prominently?
Tariff fixed by the for the packages. Tariff is a primary issue here. tariff what they have, all the government authorities, Ayushman Bharat has fixed for the so far 1,000 plus packages is a major challenge to accept them. And as far as concerned to the private sector, the patient will primarily move to the public healthcare center, PHCs, and then once the services are denied by the PHC, those services can only be adopted by the private sector of the hospitals. Tertiary care services only can be given since it is not available in the government sector. So this is what due to this many things will be imbalanced in the schemes, like the denial and acceptance of additional amount from the patients. All these will come into the picture because of a major thing is tariff fixed by the private sector. Hospital should be involved into the while fixing the tariff. What I feel, the costing is a major area which is missing. CFOs of the
That,
hospitals should be given a primary. Costing is a major primary thing. What I feel.
that's right. I think even while framing such policies, the hospitals and CFOs of hospitals should be, keep in loop. Dr. O.P. Yadav, I would like to ask a same question from you. While there is a government is responsible for things, as you said that there is a moral responsibility of a hospital to serve these patients, right? But still, why such denials? Such sort of such practices by hospitals of non-compliance of this schemes. Why such things happen so frequently, Dr. OPR?
Well, it's been answered very eloquently by Ravi Shankar Saab, and I sort of ditto all he said about making unviable packages. Let me give one example, and the health authority people are here. Double valve replacement using a bioprosthesis is reimbursed at 1,55,000, when the cost of bioprosthesis is anything from 2 to 4.5 lakhs. Now, how much, mental depravity would be required to offer such packages to the private sector and expect compliance? So it is not just frauds. We are talking of fraud. It is the inflexibility of the packages that for a complex case, you cannot raise extra bills. It's a fixed package. If you get a complication, it is taken as a fault of the doctor. See, you must realize that medicine is a moving target. No two people look alike. How can they behave alike? How will the response to treatment be alike? There might be a man who walks out of 2 days. There may be someone who stays in the hospital for 2 months for no fault of the doctor, for delayed presentation or some such thing. So these schemes have to be flexible. And because of inflexibility, we are leading to risk aversion in the hospitals, that hospitals are not willing to take difficult and complex cases. The same hole in the heart at the beginning stage, we may operate, but little advanced stage, we say no, we find faults. So risk aversion comes in, and that leads to mistrust, leads to violence, leads to medical legal litigation and all the aftermath. So, it's a kind of a double-edged thing, faults probably both sides. Some of us may be at fault, wanting more money, but genuinely there is a problem with the scheme.
Dr. Ajay, before I come to Rajat for requesting for some IT solutions of such problems, IT has solutions for everything, but still, Dr. Ajay, I would request you to tell us that, do you think you should keep these hospitals, these private healthcare stakeholders also in count while making such policies, and so that you can avoid such situations of some really undoable aspects in these such schemes like Ayushman Bharat?
National Health Authority is continuously working on this. When this scheme was launched, it was HBP, Health Benefit Package 1.0. In that, so many problems were there, we faced them, and that's why within a year, we have revised and gave the HBP 2.0. In 2.0, we separated the implant cost from the procedure cost, because sometimes 2 implants are used, and previous package master 1.0, it was not feasible for hospitals to give 2 implants at the same cost. So we are continuously monitoring and working on this and revising the rate. Very soon we will again revise the rate on this. Work is going on, and very soon we are going to give HBP 3.0. These types of problems will be covered in that. We are continuously getting feedbacks from private sectors also and working on it.
Right, Dr. Ajay, you are right. Rajat, I would like to ask you that there are problems of fraud and denial that you can see here, but there are problems with these private stakeholders that as Dr. Obi Yadav said, the situations are more complex than you put in this scheme. That you put it simply, like this has to be the payment, this has to be this, but things are very complex. So how to understand this complexity with these private healthcare stakeholders? Do you think IT can help somewhere here in both the aspects, in removing the denials and fraud, and also helping these healthcare professionals?
Dr. O.P. Yadav correctly used the word that it's a very, it's a double-edged sword in terms of what we are going to, do. We cannot deny the treatment or the claims at one end, and at the same time, we cannot, shrug our shoulders saying that this may lead to a fraud or anything. So both of them have to be balanced, in a very delicate manner going forward. And IT certainly plays a very crucial role in that. I would say that for the frauds, etc., there are checks and balances which are introduced at the initial stage, at the time of patient registration, at the time of pre-authorization, before the patient is admitted into the hospital, and thereafter at the time of claim submission. These end-to-end services are provided on the IT platform, which ensures that there are certain checks and balances that are introduced at the beginning. So, for example, a photograph of a patient, while having the treatment on the system will ensure that there are no forged claims that are initially put. But at the same time, we cannot make our system so tight in order to prevent that convenience or that ease of availing the service which we desire for. And for that, we do have another post facto audit, which we called as the anti-fraud unit. So there is a anti-fraud unit which is a part of the National Health Authority, which ensures that there are a lot of data analytics that happen post these claims are submitted and the post the treatment and everything has been availed. A lot of data analytics is done in order to ensure that if there are any cases of duplication, or in any cases we feel that false claims have been submitted, we do take necessary action on that front also. So I would say that to prevent the system from becoming a tight-bound system, we cannot push everything at the time of patient registration. We do have to move some things at the later stage, and that post-audit, act as a feedback for us to see that if our system needs to be made more tight, or what I would say is that more checks and balances need to be introduced at the time of initial registrations. So that's how it's done.
Right, Mr. Rajat. And another question which was arised that about the data privacy of the patients. What is your view on that? How do you ensure that the data theft doesn't happen? Data privacy should be maintained. Sanctity of the data should be maintained. How do you ensure that?
So there are standard practices, obviously, with regard to data storage, data privacy, etc., which are very strictly adhered to. So there are government guidelines in terms of storing the PII or the personal information of the beneficiaries, and we do ensure that all of them are adhered to very strongly. Data is encrypted, is kept in an encrypted format. And in terms of our cloud services that we avail for storage of the data, we ensure that the government the government community cloud or the GCC facilities are used in order to ensure that the data which has been stored on our systems or on our cloud is actually physically separated from any access or any outside access. So these are some of the very strong measures we take in terms of ensuring that data is secured, and there are no issues in terms of data leakage, etc. In terms of ensuring that data sanctity is maintained, the second part of your question, I would say that we do not allow for any back-end modifications in the databases. We ensure that there are proper access control and access restrictions when we are accessing those databases in our system. So this ensures that the data which is present in our system is there is a sanctity attached to that database, and we can trust that database, makes it more reliable, trustworthy, etc.
Right, Mr. Rajat. I think now we are towards the end of this session, so I will request each of the speaker for their closing remarks of 2 to 3 minutes, so that we can then close the session. Dr. O.P. Yadav, I will request you to please give your closing remarks, kind of summarize this discussion, and give your inputs, please. Dr. O.P. Yadav.
Well, thank you. Before I do that, just a small rule. I mean, Rajat gave very elaborate, what checks and balances they have. But another area, don't forget that almost 70% of the hospitals, of those 24,000 hospitals, are small hospitals with less than 20 to 25 beds. And they do not have robust IT infrastructure to maintain confidentiality. Leaks can occur at this end also, and that needs to be looked into. Well, I really enjoyed the deliberations and the viewpoints. Certainly, it's a work in progress. It's, an evolution. Changes will occur. And I'm sure as we move forward, all these issues that we are talking of will be removed. But one issue which I want to flag at this moment is that this is a central scheme, but to be implemented by the states. And whenever political overtones are given to anything, there will be some kind of resistance to that. And this is currently what is happening. No offense meant to any political party. We all want our photographs everywhere. We want our colors everywhere. And Sujata Rao, the previous Union Health Secretary, has flagged this issue. That is one of the reasons for not good uptake of this scheme is political overtones, and opposition states are not falling in line. And even where the state in power, the party in power is there, their vote share may be 40% and they won the election. But the balance 60, which belong to 10 other parties, will object to it when they say your photograph or your thing. So please, in these government-sponsored schemes, let us deliver only the health message, and there should be no photographs, no political overtones. It's my sincere plea. Thanks a lot.
That's right. I think that a similar thing happened in Coven as well, where the photos was the issue and still the issue in the vaccination certificates of people. These things are there, and I think these are this discussion leaves a lot of time. I think these are very policy and political level issues, but you are right. If you keep things apolitical, if you keep things more from administrative perspective, everybody accepts it. I think no state will be denying accepting it if it is benefiting that state. But if it is, if it looks neutral, I think people will be easily accepting it, and that is one of the major aspects to make things work. And it has happened in the past, so it can happen in future also. That's right. But Dr. Ajay Agarwal, I would request you to share your thoughts, because you are at a very crucial responsibility in NHA, looking after the quality assurance and health policy. So I would like to request you to, clear some thoughts and, give your closing remarks. And I hope, because you are from NHA, you will give a positive message to people towards this scheme, so that more and more people, a huge number of people are watching right now here in Avatar platform. Need message from you that why to connect with Ayushman Bharat and how it is important for the country.
As I told previously also, we are trying to cover as many people as possible. That's why I included the state beneficiaries and missing men. We are working on those. Despite of that, I would like to say one thing more. As Dr. Yadav told, we never feel that doctor is fault if complication occurs. Complication is very common in this profession. we have not giving extra charges for complication. We feel that only 1% of the cases lead into the complications. And if we give the other money for that, then chances of fraud, that after every procedures, a small hospital especially, put them in ICU for 2-3 days to get the extra money. We are still working how it can be implemented. But I accept कि in near future we will improve it up to that level that most of the hospital will like to join our scheme.
Okay, I think our discussion is getting better now, but we are have a paucity of time. So I request you, Mr. Ravi Shankar, to share your thoughts on as a closing remarks.
What we feel that liberty should be given to the patient rather than the government hospitals, like choosing of since the many private sector hospitals are involved for the treatment. Even the, I mean, APL card holder is the biggest stake in the Ayushman Bharat. Now, I mean, that leverage 30% of the package amount is given by the government and 70% should be borne by the individual. So that when all these things are given, that selection of a private sector hospital should be given to the patient itself. Now what is happening is, once the PHCs are denying for the service, then only we can avail those patients for the treatment. And geographical limitation like state to state, those things should be removed. I mean, any patient from wherever from the India should go and get a treatment in whichever hospital he select. So this will definitely improve the quality of health, and a private sector hospital will get a more opportunity to treat a patient. What I feel.
Right.
So we have portability for patient can go to any hospital all across the country. This facility is available
Those,
for the beneficiaries.
those guidelines are available, sir, but implementation still we are feeling a glitch in the implementation.
Okay.
Yeah.
Okay, so I think there are. I request Rajat to please give your closing remarks, Rajat, before we close the session.
Yeah, so I think some of the major issues that have been raised in in the last few comments, just want to give a brief closing remarks on all of them. So in terms of the data privacy leaks that might happen at the client side, I would say that we ensure that there is minimum amount of data storage, or in fact there is absolutely no data storage which happen at the client side, and most of it is very centralized in terms of the cloud storage we have at the NHA. So that is one of the aspects. The second aspect, in terms of the portability, or in terms of this, I feel that IT has a very streamlined that process in a very convenient way. So there are beneficiaries which can move from one state to another, and a common platform on that front. It does facilitate both in terms of the convenience or the familiarity aspect. The other point I would like to add is that for any platform, or for that matter, any IT infrastructure, be it in the private space, or the startup space, etc., anywhere, crowdsourcing or the number of users does make a lot of difference to that platform. So as the number of users go up, the value of that platform also keeps on rising in terms of the kind of feedback we get in the platform, the convenience of usage, the flexibility, and the reliability of that platform, etc. So similar thing is happening in Ayushman Bharat, in PMJY also, that the number of users are going up every single day. The large number of schemes are coming on the same platform. Large number of states are coming on the same platform, and obviously these things are going to facilitate. One has to understand that the at this nascent stage, even if this basic uniformity all across India is not just in terms of a common platform, but also in terms of an ideology, where I would say that for a common person who is using a same platform across the country, there is going to be unification in terms of the healthcare facility that are across the country, and that is going to be something that is going to be a game changer in the healthcare sector for the country. Further, I would say that obviously when we are building our IT structure, the central point obviously is always convenience. So there are fraud checks, there are checks and balances, and all of that is taken due care. But that is not at the cost of convenience of all the stakeholders which are a part of this whole process from end to end. And we keep on improving our platform in order to ensure that there is ease of usage, there is reliability, and there are seamless services which are provided to all the stakeholders.
Right, Mr. Rajat. I think everybody has put their point very well here. And the summary is in the form that yes, the intent is very good for the scheme. It is more digitized than its previous versions, and with the vision to reach to the last mile. But there are challenges, there are bottlenecks which has to be worked upon, and there are aspects there should be more compliance with by the hospital, but there are issues with hospitals also which have to be taken care by the government, while so every state's issues, every hospital's issues. So I think more collaboration, more better collaboration, there is a scope of it, and nobody denies that government is working towards it. And the issues like data privacy, issues like interoperability, issues of technology implementation, we are quite hopeful that technology will improve such issue, will improve in situation, and will deal with such issues. So we had good presentation from hospital side and from government side. It was a good interaction, good questions, good answers, and it was a wonderful discussion as far as I look as a moderator. And thank you so much, Mr. Yadav, Dr. Yadav, Dr. Agarwal, Mr. Rajat, and Mr. Ravishankar, for being part of this discussion, for a wonderful opening of day 2 of Digital Health Conclave, and look forward to more participation from you in our other events. And audience, we'll meet you in other sessions. And before that, we would like to present speaker certificate as a token of regards from Elets Technomedia, that you spared time and joined us in this discussion. I would request my backend team to present those speaker certificates. We'll also be sharing it with you over email, but we would just like to present it. So, are we presenting speaker certificates right now? Okay, so we will be sharing those speaker certificates with you over email, and I thank all of you for joining us and sparing time for us in this session on Ayushman Bharat: Opportunities, Scopes, and Challenges. Thank you so much.
Thank you so much. Thank you so much for this.
Okay, so here are the certificates. Sorry for the delay. Dr. Ajay Agarwal, Director of Health Policy and Quality Assurance, NHA, Government of India. Thank you, Dr. Ajay Agarwal, for being here. Can we have another certificate, please? Mr. Rajat Agarwal, Deputy Director of IT in Ayushman Bharat, PMJAY. Thank you so much, Rajat.
Thank you.
You are a bright person. I think technology is in bright hands. Dr. O.P. Yadav, CEO of National Health Institute, enjoys the leadership in healthcare sector. Thank you, Dr. O.P. Yadav. And Mr. Ravi Shankar, you really shared great thoughts and great concerns, the CIO and Administrator IT of KLES. Thank you so much, Mr. Ravi Shankar. And here we close the session. Thank you.
Thank you.